Hi, my name is Alex New. I'm an assistant professor of medical oncology here at Roswell Park Comprehensive Cancer Center. From an early age, I knew I wanted to be a doctor because I really enjoyed helping people. Now, there's a lot of different ways to help people. What really drew me to the medical field is that when people are concerned about their health, it becomes a whole nother level of fear and anxiety. And I knew I wanted to help people when they're in that most vulnerable state, when they feel very, very helpless. And so that's what really drew me to be in the medical field. Now, going through my medical career, as I started going through each part and seeing how patients responded, it just really further validated that this is what I wanted to do, that I really wanted to be here for these patients when they needed help. When people hear the word cancer, it almost throws them into an even scarier and more vulnerable state. I wanted to be there for these patients when they felt at their most vulnerable, when they felt the most scared. And I think to go further into that, I chose lymphoma because I think that carries even furthermore. We see so many people with lymphoma, you hear about it, people dying from lymphoma. So when people hear the word lymphoma and that is their diagnosis, they get very, very scared. And I wanted to be there to help them through that stage, from the very beginning, from their diagnosis to developing a treatment and then to the outcome of that treatment. I wanted to be there for each step for not only the patients, but also their families. Patients should consider coming to Roswell Park for a lot of reasons. Number one, it is an NCI designated comprehensive cancer center, meaning that we have access to the best clinical trials, the forefront of everything that's going on in the field, access to the most innovative drugs. You want a cancer center that's there and has access to all these things because, we want the ability to have, hey, this is treatment plan A, but in the unfortunate circumstance where that doesn't work, you want to have treatment plan B, C, D, E, and F available, ready to go. And Roswell Park offers that ability. Now, along with that, Roswell Park it's a smaller cancer center compared to some of the other cancer centers out there, but because of that, you get a more personalized experience. So as opposed to just kind of getting lost in a shuffle of thousands and thousands of patients can get a more personalized touch, more tailored experience. And from what I've seen so far, patients have loved that, and it really makes their experience that much better because they're already coming in being scared, going through chemotherapy, going through all these different tests. When they come and see a familiar face and are ready and just more personalized experience, I think it helps with that. The reason why I chose Roswell Park was because of the NCI Designated Cancer Center. I wanted the opportunity to provide all the resources available to my patients. So if things didn't go as we wanted, we would have access to all the other options on the table, and we definitely owe that to our patients. And so the ability to have access to all those different things was one of the big reasons why I chose Roswell Park. Number two was just the community. Buffalo is obviously known as one of the nicest places to live in America, as well as being a great city of neighbors. And I thought that this would be a great place to be kind of enshrined into the community to not only treat patients, but also grow into it. And so that was the big reasons why I chose Roswell Park Cancer Center. The number one thing I love about my job is the ability to treat patients. I think there is no job out there that is more gratifying where patients are so scared and nervous about their health or the health of a loved one, and to be there for them and to take them through every single step so they're comfortable with it. There's no more gratifying experience. Along with that, the ability to kind of further the field, to develop research and just focus on what else can we do to bring our fight against cancer to hopefully move towards a cure. So both of those things really just drives me to come to work every single day and to be here for my patients.